An atrial septal defect is an abnormal opening between the right and left atrium, causing an increased blood flow of oxygenated blood into the right side of the heart. So this one is a left to right shunt. The manifestations that we expect to see in patients with atrial septal defect include an activity intolerance, decreased peripheral pulses, feeding difficulties, hypotension or low blood pressure, irritability, restlessness and lethargy, oliguria, pale and cool extremities, as well as tachycardias. This heart defect is managed by cardiac catheterization closure of this defect, and as well these patients can have an open repair with cardiopulmonary bypass being performed, and usually it is performed before school age.